Hi and welcome everyone. Thanks again for stopping by my video series on my open heart surgery and recovery. My name's Todd, and if you're new to the series, please check out my first video for a little bit of background on the series. If you've been following along, thanks for sticking with it. I really appreciate it. Apologies for not making any videos lately. It's been pretty hectic the last couple weeks. I've had a lot of visitors lately, which is great. My folks tend to take like a midday nap because they're up and about taking care of me and cooking and all that kind of stuff. So it's tough to get in my room here. They've been staying in this room, so I don't really want to bother them. And also, it takes a while to make the videos. I have to, film them, and then it takes a while for them to render out and then upload into YouTube. So thanks for your patience. I'll try to knock a couple out here really quick. Today we're going to talk about surgery day +2. That's the third day I'm in hospital for the surgery. The previous video, I talked about how the second day I was there or the first day after surgery was really frustrating and a lot of work. Today we're going to talk about the next day, and that showed a marked exponential improvement on my health. It was good. So overnight I didn't sleep very much for that time. I was sore. I'd have hourly vitals and blood sugar tests by the nurses. They'd come in and check everything out. And I was just generally frustrated by my ability or inability to do a really good job on the incentive spirometer. In a previous video I talked about this thing right here. It looks kind of weird, but basically you gotta use this tube and inhale as hard as you can, and the plunger goes up to these gradated or marked, we'll say marked, it's like pig, porky pig, marked areas on the spirometer. And I was doing very little. I couldn't do what I needed to do. So I was really frustrated by that, and that kind of kept me up, being nervous about that. I actually didn't even get in the bed that night. I stayed in the chair the whole night when they came to check on me. When I woke up, I was able to get some liquids for breakfast, but they started saying I could have some solid food for lunch and dinner. So when the catering folks came by, they give you a menu. It was pretty high speed looking. They gave you a menu about what you could get. The food was okay. I mean, some stuff was really good, some stuff wasn't that amazing, but I was very happy to get any food I could at that point, just some solid stuff. So some of the surgeons, physician assistants, the PAs came around to see how I was doing, and they were really pumped about looking at the incision. Like, we really want to see what it looks like, so they took off some of the bandaging I had on the sternotomy. That's that when they cut through your breastbone, so they wanted to see how everything was going, and everything was looking great. So they left it open so it could breathe, get some air to it, which was fine. Everything else, like where the chest tubes were, that's still patched up. The chest tubes are still in at this point. So at this point, they also said that the incision looked great, and they could remove the Christmas tree. That's that big catheter that's sticking in my carotid artery that I had, and you can see in one of the videos earlier. It's pretty nasty, although I didn't feel it. So I was happy about getting rid of that. They ended up taking some blood first from using that catheter. They needed to do a last-minute blood check, and then they pulled it. Now when they did that, they numbed it a little, I think, and then they had some bandaging there, and it was just pressure from them to keep it from bleeding or squirting out and stuff like that. And then they removed it. It didn't hurt. I really didn't feel anything. It was fine. I was just happy to kind of get rid of that thing. And in the morning hours, there's a herd of doctors and doctors to be to kind of do the rounds, and they sit outside your curtained area or your doored area, and they talk kind of low. Patient 37-year-old male patient had a valve replacement, doing really well, blah blah blah, as if you can't hear what they're saying. I totally hear what they're saying, but they came in. Doctor introduces himself. This particular doctor was my my surgeon's partner in the firm, a really nice guy. And then everybody comes in, I'm just like, hi folks, how's everything going? And then I'm just kind of, they just walk through, and it's almost like they're at the National Gallery or at a museum, and they're just, Big Ben, Parliament, as they walk by, and then that's it, and you just kind of smile and they walk by. It's no big deal. It's just pretty funny to me. So after that, I was able to get up, do a walk, felt really good, and it's kind of cool walking around that area. I was probably the youngest guy or the youngest person on that unit. Most of the patients are at least 10 to 20 years older than I am. I think since my surgery was related to a congenital or birth defect, most of the folks on there are there for something that's old age induced or disease induced or something like that. So, but everybody's really positive. You know, you walk around, you see the nurse, you see the other patients, and you always kind of say, hey, you know, you give them a little, what's up, a little head bob, and keep going. You know, good job, you're moving around pretty well, and that was really cool. You know, it's kind of like a little community thing working there. So that was nice. I try to do my best too to say, hey, how you doing? You know, you're moving along great, good looking. How you doing? I saw one old lady who was really struggling, and I'd say, hey, gorgeous, keep it up. You're moving along great. You know, she didn't really hear what I was saying, but it was an effort. You know, I tried to help out. So I came back and I met another PA, and man, she was awesome. She was really funny and nice and explained everything really well and professional and but down to earth, you know. So I felt really at home working with her. And she told me that the chest tubes were going to be coming out in a little while. So she had to take care of a couple things. That was great. While she was gone, I had a tech come in to give me a bath, and that's really embarrassing. I mean, I'm in bed. It's not a real bath. I mean, you're sitting in bed, and the tech was really cute and super nice too. But and I told her, I said, I'm really embarrassed by this. She's like, don't worry, I see this stuff all the time. It's nothing I haven't seen before. So I got over it. But it's basically like they take, you know, like baby wipes kind of thing. That's what it looks like. It's just like a moistened towel with some kind of antibacterial on it. And they just kind of wipe down your legs, and they take clean towels and just kind of pat you dry. And then they give you stuff for yourself so you can handle your own business, you know, unmentionable areas. So you take care of that, and they did a little on the chest area and the arms and some of my face so I could clean up a little bit. I felt a lot better having done that. It's obvious, you know, it's not like a real shower, but it does make you feel a little better, get kind of cleaned up and get some of the stink off you. It's pretty, you feel, at least I did, I felt pretty nasty by that point. I'm always self-conscious that I smell bad or look dirty or whatever. So while the tech was doing this, she did a really good job of explaining how to clean the incision, which is something I was going to have to do myself when I got home and taking a shower. And basically they're telling you every open wound you have, use a clean washcloth, and you lather up with regular soap, and then you kind of work in like from top to bottom. So the first wound I had was my sternotomy, the big scar I have down my chest now, or my second scar down my chest. And then you just kind of work in a circle, and it's not too hard, not too soft. I said, so like baby bear side? She said, yeah, that's a baby bear, nice, just right, you know, just kind of work your way down, you rinse it off, flip the rag over, or washcloth over, with soap and everything, do the same thing again, and then you get rid of that one. You get another washcloth for each individual wound. So the second set of wounds would be my chest tube wounds when they were going to come out, and then I would go, you know, across them with a thing, rinse them off, flip over the washcloth, do that again, rinse it off. And then the third wound I had was the femoral artery catheterization. That's that big scar I have in my groin, which was sewn up. So I did the same thing, third washcloth, soaped up, scrub down, everything like that. And you just work from the top to bottom, and that's, she did a really good job explaining how to do it, and I felt really comfortable after that. So get to that point, it's about lunchtime, get to have a little lunch, my first solid food. I think I had some like meatloaf or something, which I was just happy to get. I could have eaten just like a sandwich and been a happy man, you know, it was fine. Oh no, actually, you know what I had? I had grilled cheese and tomato soup. Man, it's probably the best grilled cheese I ever had in my life. It tasted so good, just having like solid food and being able to, you know, kind of move forward. So, and then the PA came in that I talked to earlier about removing the chest tubes, and it was time to do it. So I told her I was really nervous, and if you see my videos, I mentioned the chest tubes a lot. That's something I've been really nervous about the whole time, both in the recovery, beforehand, and then, you know, waiting for them to come out. And it's been really effective. I mean, it affects how I can do the spirometer and all that kind of stuff. So I told her, I said, I'm really nervous. And she said a wide range of patient reactions to the removal of the chest tubes. Some of them are say it's painful, some of them say it doesn't bother them at all, but I'll feel it, you know. And what was going to happen was she was going to, there's some sutures that were holding the tubes in place. I had 3 tubes, one that kind of went up to this side, one that kind of went up to the center, and one went up to the other side. I could feel them in those locations. And they came down into like a T-junction where all 3 of them went into, and that T-junction went to that little briefcase which kind of provided suction and measured all the amount of runoff or fluids that were coming out of the chest. So she was gonna go to each of the tube locations and snip the little incision, or snip the sutures off, and then she took some gauze and packed around it, and then she was just gonna, you know, I had to inhale. This is what she's telling me I have to do. You have to inhale, hold it, and then she's just gonna 1, 2, 3, pull them all three out, pull all 3 of them out at the same time. So she does all that stuff like I just said. She's got the gauze there ready to go to put it down and kind of hold pressure on afterwards. And just as she's just about ready to say, okay, take a deep breath, my dad comes busted in. Hello, how's it going? Everybody okay? And he sees her. I'm laying in bed like this, and she's getting her like holding the tubes. And I said, Dad, could you excuse us for a sec? There, she's gonna pull the chest tubes out. And my dad just okay, yes sir, okay, I got you. And he just rolls out. So that was fine. And then after a quick laugh, I said, okay, go ahead. And the PA says, all right, so inhale, hold your breath. And then as I did that, she pulled the tubes out. And that's a weird feeling. I mean, for me, it didn't hurt. It takes the breath away from you though. I mean, it feels like somebody's got their hands inside, like right down the center especially, and they're squeezing jelly between their fingers. As it's going through, you can feel it kind of like, it felt like jelly was getting squished around in there. That's what it felt like to me. It didn't hurt, but it definitely like takes the breath away. Almost like if you get like a cold water bucket thrown on you, you're like, I mean, I'm holding my breath as it is at that point, but that is such a crazy feeling, and I'm just glad it didn't hurt. But I immediately started feeling better from that point on. That's definitely like a tide turner in the recovery, is getting rid of the chest tubes. So she's sitting there, she's saying, "You doing all right?" I'm like, "Yes," and she started laughing. She started laughing, and I was like, "Don't make me laugh, don't, it hurts to laugh, it hurts to laugh." So, but she was putting pressure on the locations, you know, and then she taped them up with some gauze to kind of, just for a while, to let them, you know, stop oozing. And then she said, "You want to see the tubes?" And I'm like, "Nah, man, I don't want to see it." "Okay, show me the tube." So she showed me one, and they're long. They're like this long. So they go in, like the insertion points are above my navel and below my rib cage. So they go from there to there. That's long. It's like about a foot. Those tubes, the amount that's in your chest. It's daunting to look at that, but very happy to see it go. And I said, "All right, that's enough. Take them away. I don't want to see any more." And she laughed at me again. So it was okay. I was happy to get rid of them. So at that point, I mean, I'm in bed, laying down for this part. Decided to rest for an hour. That's what she said. Rest for an hour. You don't do anything. Just kind of chill out. Get over that little experience. So did that, and my folks were there. One thing I forgot to mention is about, you know, difficulty using the restroom. So when I had the urinary catheter removed, they give you this, what they call the urinal, and basically it's like a water bottle where it's almost like, you know, it's like a quart milk jug, and the top third is kind of angled. Not that really helps you to kind of aim how you're gonna get stuff in there, but it's got marks on it to tell you how much you're accumulating too. So when you urinate, you know, and it fills up, they can see how much you're doing per day. So they're actually keeping track on my board how many milliliters of urine I was disposing of, because they're giving me diuretics, which are drugs that make you pee, get rid of the extra fluids. So it's really important for them to measure that. So they're taking that information on top of the amount of fluids that are leaving through the chest tubes, and you know, there's some formula or something that they're saying that I need to make every day. So I had this journal thing, and it's really hard to use that, especially when you got a bunch of tubes coming out of you and stuff, and you're trying to angle and you can't really move. I'd much rather just go use the restroom, but you can't really get up out of bed that easily. So that's that. We'll speak of that no more. So by the end of the day, the spirometer, I was close to where I needed to be. I felt really encouraged by that. I was a lot happier. I already started feeling better when I was, you know, using the spirometer and taking deep breaths, and coughing. I was starting to cough and break stuff up, and it hurt a little bit, but it wasn't as uncomfortable as when I had the chest tubes in. Went for another walk, had some dinner, and then at that point, there wasn't a lot of stuff left attached to me. I had 2 IVs, one in each arm. The insulin drip was still going. I still had the leads for like the echo or the EKG or the heart rate stuff. I I still had the external pacemaker in. That wasn't going to go because it had kicked on a couple times during the day. And then at that point, I felt really, really good and relieved and just 180 degrees better than the day before, where I was just frustrated and upset. So at that point, it's the end of the day. My folks have already gone home. I've only got a couple things left. I get into bed and I have high hopes that the following day I'd be leaving, and I did. I was able to do that. And then the next video, I'll talk more about that final day in the hospital. So thanks again for following along. I'll upload this sometime today, hopefully, and then really appreciate the support, and I'll see you on the next one. Thanks a lot. Bye.